Do you know that a lot of women out there gives birth to babies with abnormalities because they were ignorantly taking drugs when they were pregnant without knowing the effects of these drugs on their growing babies inside their womb? Hi, this is Pharmacist Donald. As a public health enthusiast, it's always my pleasure to give healthy information to the public. If you are seeing my face for the first time, please like, share, and subscribe to my channel. That is your own way of encouraging me to continue to give out healthy informations to the public. If you are a returning subscriber, this is me telling you thank you. So, drugs to avoid during pregnancy are generally categorized into three. Number one is the high-risk drugs, which you have to avoid them entirely. You have to avoid them entirely. Number two, the moderate risk drugs. You have to use them with caution, and you have to use only when the benefit outweighs the risk. Number three, the low risk drugs. They are generally considered safe, but they have potential side effects. So stay with me to the end of this video to get to know these drugs and also avoid them when you are pregnant, or when your wife is pregnant, you let the wife avoid them. Because imagine waiting for pregnancy for 1 year, 2 years, 3 years. When the pregnancy finally comes, you ignorantly take drugs as a woman and you end up giving birth to a abnormal baby, and you will not cherish the baby as you always wanted. So the high risk drugs to avoid during pregnancy includes the isotretinoin, warfarin, lithium valproic acid is one of them. We have the phenytoin, which is one of them. Methotrexate is these drugs that you should avoid totally during pregnancy. We have the cyclophosphonates. We have the biphosphonates. These are drugs to be avoided entirely. We have ACEI inhibitors. They are common antihypertensive drugs, the lisinopril and the ramipril. And also we have the ARBs, the angiotensin 2 receptor blockers, another antihypertensive, that is the losartan and the valsartans. So we have the statins, the rosuvastatins, and also we have the thalidomide. So these are high-risk drugs to avoid entirely during pregnancy. Category 2, the moderate risk drugs. You have to use these ones when the benefit outweighs the risk, and you have to use them with caution. We have the tetracyclines antibiotics. We have the fluoroquinolones antibiotics. Examples is the ciprofloxacins, the levofloxacins, and also we have the anti-anxiety drugs, the benzodiazepines. We have the macrolide antibiotics. Example is the erythromycins. And also we have the migraine medications, the triptans. We have the anti-inflammatory drugs, the NSAIDs. Example, NSAIDs. Example of these NSAIDs are the ibuprofen, diclofenac, aspirin. They are common aspirin, acetyl salicylic acid. So these are the category 2 of drugs you have to avoid as a woman during pregnancy. Now, let's look at the category 3, the group that is generally considered safe but have potential side effects. We have, in this group, we have the paracetamol, you have acetaminophen. We have the penicillin antibiotics, the cephalosporins antibiotics. And you have antihistamines, antiemetics, drugs that you take to stop nausea and vomiting. So these are the different categories of drugs that you are to avoid, understand, during pregnancy. Even if you have to take, you take them with caution. Only the low risk or the moderate risk, you take them with caution. Only when the benefit outweighs the risk. Before you are asked to avoid these drugs during pregnancy, means that they have teratogenic effects. That is, the ability of these drugs or the substance to cause birth defects or developmental abnormalities to the fetus or the embryo that is growing inside your womb. Note, It is always important to consult your doctor, your pharmacist, before taking any drugs during pregnancy, because even the low-risk drugs, the moderate-risk drugs, can have their potentials to cause defects to the baby during pregnancy. Thank you for staying to the end of this video. If you find value in this video, like, share, and subscribe to my channel. That is your own way of encouraging me to continue to give out useful information, helpful information to the public. Thank you, and see you in my next video.